Hey, Dr. Malka here. In this video, I'm going to show you several effective back stabilization and strengthening exercises for scoliosis or just overall back health. So here we have an example of a straight spine. These other four are scoliosis, which is a curvature of the spine. And regardless of where the scoliosis is, it can cause pain throughout the back and the neck. Many people with scoliosis just want to be massaged. It feels so good. But massage only gives temporary relief. Although there is no cure for scoliosis except for invasive surgery, it is strengthening and stabilization exercises, not massage, that can give lasting relief. The body always wants to maintain balance. With a scoliosis, the back muscles are having to work overtime to keep the body erect. Therefore, the stronger and more stable the back muscles are, the less effort needed to maintain posture, and therefore less strain on the muscles. In this video, I'm going to show you several effective back strengthening and stabilization exercises, regardless if you have a scoliosis or if you just want to maintain back health. So the first exercise is to strengthen your mid-back muscles. So you're going to put your arms like this and squeeze together as hard as you can. Make sure you're not raising the shoulders up. The shoulders need to be down and together. And this is really just an overall really good postural exercise. So when people are kind of hunched over in front of their computer, I pretty much give this to everybody. And the two muscles that you're strengthening in this position are your rhomboids and your middle trapezius. And the second exercise I'm going to give you also strengthens the mid-back, but more the lower mid-back muscles, or what we call the lower trapezius. And those are going to be rotating your arms out like this, like you're hitchhiking. Squeeze down and together. So these scapula, or these little wings, you're trying to get those in your back pocket. So the exercise is down and together, kind of in an oblique position. So now that I showed you strengthening exercises of the mid-back, now I'm going to show you how to strengthen your low back. So you're going to lie face down, straighten out one leg, and lift it up about 2 inches. No more than that. If you start lifting it up in the air, you create an arch in your low back, and that can cause strain. Then bring the leg down, bring the other leg up, and you'll hold this for about 10 to 15 seconds. And then after this is no longer a struggle, you're going to lift them both up together. And keep in mind, this is only going to be brought up maybe 1 or 2 inches. And then after that one is just a piece of cake. You can then lift up your legs, keeping them straight, and then lift up your arms and your head. And again, you're only going to do this maybe 2 or 3 inches. And then hold it. Maybe even for 40 seconds. We'll see how long you can hold it. Then relax down. And then lift up and hold it. So with any of these exercises, the low back exercises, you don't want to do any hyperextending because that can actually put pressure on the discs of the low back. And sometimes there's a lot of gym equipment that has people do that, and you see them doing these exaggerated motions with their low back. That really needs to be avoided. So let's continue with pelvic stabilization exercises. The whole concept of pelvic stabilization exercises is to get all the muscles working together in balance. And the first one I'm going to show you is a pelvic tilt. So you'll want to bring your belly button into your spine, so essentially you're tightening your stomach muscles. You tighten your buttock muscles, and you're just going to tilt your spine, pushing your low back into the table. And if you have a lot of pain, maybe this is really all you can do. Tighten the stomach, tighten the buttocks, and tilt. And then when you feel comfortable, tighten the stomach, tighten the buttocks, and come up. And you want to keep your elbows off the floor. And you want to create a really nice straight plank. And at any time this hurts your low back, just back down. So here we are at the top of the position. And then as you come down, vertebra by vertebra by vertebra, And the buttocks is going to be the last to touch. And then we'll relax. Start this again. Tighten the stomach muscles. Tighten the buttock. Pelvic tilt. That's pushing the low back into the table or the floor, creating a flat spine. Coming up first with the buttock, and then slowly bringing the spine up from the low back up to the mid back, and then up. And I actually call these tushy pushies. That's my cute little nickname for them. And then come down slowly, slowly, and be aware of the control. If you're jittering around in the hips, you really want to kind of lock them in. And then the buttocks is the last to drop down. Again, tighten the tummy, tighten the buttocks, roll the pelvis, and come up, starting with the buttocks, squeezing that buttocks, and then up, and then you're even now. If you're at this point and you feel pretty comfortable, you then want to, with 1 inch, lift the right leg off the table. Now, when you do this, if the hips start dropping, then peel back and then just do the bridging exercises. But if you're stable with that, then bring up the left and then down just 1 inch. And this really tests your balance. Once you feel comfortable marching back and forth with that, you can then lift the leg up, straighten the leg, hold it, bring it back, and then down, and then bring the other leg up, straighten it, bring it back, and then down. Now, if there's any pain during this, again, peel back and maybe just continue with the bridging exercises. And this really creates a weight belt where it just locks in all these muscles so they work together. And then down. Ready? So the next stabilization exercise will help to balance out the mid back and the low back. So you're going to start on all fours. Your shoulder joint is going to be right above your wrists, and the knee is going to be right below your pelvic bone. And then you want to bring the right hand up and the left leg back. The bottom leg, the toe should be pointed just to create a little more need for the body to balance out. But this should be a straight line, and the leg should be a straight line. It shouldn't be up and it shouldn't be down. The idea with stabilizing here is that everything is in alignment, and that creates challenge in the body. And then switch, bringing the left arm up and the right leg back. You can point the toe or just drive the heel back. And again, it should be a nice straight line. And the head is just looking down. And then switch. You can hold this for 10 seconds or up to a minute. Whatever your comfort zone is. And then bring this down. Left arm up in a nice alignment. Right leg back. If you curl your toes under, you'll create a little more stability, but you really do want to, this is a balancing exercise, so it's better to keep the toes straight. We will be launching a new YouTube video every Wednesday and Friday at 3 p.m. and I'll be available for any questions you have or suggestions for future videos. To allow me to make more videos for you in the future, please press the subscribe button, press the notification button so you don't miss a video, and press the like button. and be sure to share with your friends and family.